Hey, you guys, welcome to our Work It Out Wednesday of our practice question series. You know that we've been doing this this is week two. We'll be doing it for the whole month on our Tuesday, Wednesday, and Thursday series. But this is Work It Out Wednesday anyway, so let's get into the practice questions for today. This week we have been covering endocrine, renal, GI, and neurology. And if you missed the one from yesterday, go back and take a look. All right, question number one. Question number one states a patient presents to the office today with complaints of increased sweating, tremors, and increased heart rate. The nurse practitioner notes exophthalmos on exam. The patient states that she has lost weight over the past 2 weeks. Based on these findings, what steps should the nurse practitioner take next? Is it A, obtain a thyroid panel? B, have patient to return in 1 week for follow up? C, obtain a lipid panel? Or D, nothing, the patient will be monitored at the next appointment? All right, you guys, take a moment and tell me what you have in the comments. All right, you guys, I always tell you to read the stem of the question first to ensure that you are answering what's even being asked. So, based on these findings, which steps should the nurse practitioner take next? So, what do we have? So, a patient came in, they're complaining of increased sweating, they're having tremors, they have an increased heart rate. The nurse practitioner notes exophthalmos. So, the patient has some weight loss over the past couple of weeks. So, you need to first start thinking of your differential diagnoses in your mind so then you'll know what tests and things you may need to do next to confirm or rule out certain diagnoses, right? So to me, I always tell you guys about key identifiers. Right off the bat, the exophthalmos makes me start to think of Graves' disease, right? So my mind instantly went there. And so then I kind of backpedal and see if the symptoms, the presentation matched that. So they increased sweating, tremors, increased heart rate. Those are, symptoms, common symptoms of hyperthyroidism, right? And Graves' disease is the autoimmune disorder associated with hyperthyroidism. So here, the best answer choice would be A, to obtain a thyroid panel, right? Because you want to rule out or confirm your differential diagnosis there, right? Returning in 1 week is not solving anything. Obtaining a lipid panel, this doesn't really show anything for hyperlipidemia, so you can X that out and nothing and just continue to monitor them at the next appointment isn't solving anything either. All right, question number two. The nurse practitioner diagnosed the patient with stress incontinence. She is preparing to discuss treatment options that can be done. What is one option that she should recommend? A, drink more water to stay hydrated. B, Kegel exercises. C, prescribe Lasix to control the frequency of urination. Or D, no recommendations are warranted for stress incontinence. All right, you guys, take a moment to tell me what you think in the comments. All right, so the stem of the question states she is preparing to discuss treatment options that can be done. What is one option that she should recommend? So we're talking about stress incontinence. So when you think about stress incontinence, you want to kind of think about what it is and then what you can recommend and treat with, right? So stress incontinence is typically, well, is I should say, something associated with some form of stress that is causing the incontinence. So coughing, sneezing, laughing, any force on that pelvic region can lead to that stress incontinence, right? And so you want to think of recommendations. So drinking more water for hydration. Of course, we want our patients hydrated, but we're not trying to push the water on somebody who's already having, incontinence, right? Not increasing the water, I should say. Kegel exercises, absolutely. You want to recommend Kegel exercises to strengthen that pelvic floor to help with stress incontinence, right? So B is your best answer, Kegel exercises. All right, question number three. A patient was diagnosed with pancreatitis, and the nurse practitioner is explaining to the nurse practitioner student that there is noted bruising around the patient's umbilicus. What shows the student's understanding when she mentions the name of this bruising around the umbilicus? Is it A, Rand sign, B, Cullen sign, C, Murray sign, or D, Murphy sign? All right, you guys, I'll give you a little bit. Tell me what you got in the comments. All right. So the stem of the question states What shows the student's understanding when she mentions the name of the bruising around the umbilicus, right? Is it A, Ransine? No. B, Cullen sign? Yes, right? Because we always say think C because it looks like it's C shaped around the umbilicus. It goes around just like the shape of a C, and the bruising does around the umbilicus, and that's Cullen sign. And it's a classic symptom or presentation, I should say, for pancreatitis. So B is the best answer. Cullen sign. A and C, I made those up. And then, D, Murphy sign, is the test to confirm your diagnosis of cholecystitis. All right. And question 4. The nurse practitioner documents left-sided facial paralysis on exam of Miss Smith. She states the patient denies any other complaints at this time. Based on these findings, what cranial nerve is affected? Is it A, cranial nerve 2, B, cranial nerve 11, C, cranial nerve 7, or D, cranial nerve 8? Take a few minutes and tell me what you have in the comments. So the stem of the question states, based on these findings, what cranial nerve is affected? Cranial nerve 2. Is it A? No, not with facial paralysis, right? That's dealing with the ocular, right? Cranial nerve 2, you have two eyes. Cranial nerve 11. Nope. And cranial nerve 7, see? Yep. 7 is the facial, right? And cranial nerve 8, you can rule that out too because that's acoustics for the hearing, right? So the best answer here is C. And you guys make sure you are keeping yourself up to date with those cranial nerves, just being aware of what each of them are and what they're associated with. All right, you guys, as always, make sure you like, comment, and subscribe. And be sure to share with whomever you may think may find this beneficial. But make sure you meet me back here tomorrow. We have another work it out. I should say practice questions for tomorrow. Just like this, we'll still be covering the endocrine, the renal, the GI, and the neurology sections. Again, if you missed the one from yesterday, take a moment to go check that out. Test your knowledge on how you're doing in these system areas. If you have questions or anything that you need me to delve into a bit more, feel free to put it in the comments and I'm happy to assist you. And if you missed any of the videos on last week, go check those out as well. We did cardiology, EENT, respiratory, and anemia all last week. So stay with us as we continue to cover these practice questions all month long. And let me know if you're finding these helpful. All right. Bye, y'all.